edition. Thank you. Welcome to our May edition of our Emerging Practice webinar series. My name is Jessica Gorham, and I'm the Regional Emergency GBV Advisor working on behalf of the Gender-Based Violence Area of Responsibility here in East and Southern Africa. But for the purpose of today's call, I am also the co-chair of our regional GBV working group for East and Southern Africa. And so, as many of you know, we host our emerging webinar series every month, and we try to highlight current events, and then also, more importantly, what our partners are doing on the ground to help prevent, mitigate risks for, and respond to gender-based violence. So just to let everyone know a few of our ground rules, if you could please put your videos off. So if you could please ensure that you do not have your videos on. We have people joining us from many different countries throughout the region and throughout the world, and who have very different bandwidths. And we have found that if everyone keeps their videos off, it does help. So thank you for that. Also note that everyone will be on mute throughout the presentations. If you have a question for one of our speakers, we would encourage you to write your question in the chat. I will be monitoring the chat throughout the presentations, and this way I can group like questions together and we can answer more questions that way. So please, if you have any questions, please do add them or write them in the chat, and I will be collating the questions and we'll present them to our speakers during the Q&A portion. As was noted in the invitation, today we're going to talk about the impact of the flooding, the unprecedented flooding that's been happening in East Africa, and I know also in Southern Africa as well. And we're going to specifically focus on the impact that climate change, and more specifically the flooding, has had on the safety of women and girls. And we're going to focus on gender-based violence. So we appreciate all of you joining us. As usual, our webinars are always approximately 1 hour long, so we hope to have this completed by around 3:30. And just a reminder, if you could please turn your videos off, and then also make sure that you're muted. And if you have any questions, please do feel free to add them at the end or in the chat, and I will present them at the end during the Q&A. I'm really excited to share that we have two wonderful presenters today who are frontline service providers in Kenya. We have Kenneth Kamande, who is a public health program manager for Red Cross Kenya, who is one of our key service providers for many organizations in Kenya, and who are doing frontline service provision in communities affected by the floods. After Kenneth, we have a colleague from Accord Uganda, David Othweri, who will be joining us, who is the M&E specialist for Accord Uganda, and he will present on some of the challenges and risks that they have been experiencing in Uganda in reference to the floods, and then also what Accord Uganda has been doing to help mitigate some of those risks. And the hope is that we can learn from some of these experiences and also know that we're not in this alone, that we have a broad community here in East and Southern Africa, and we're here to support each other. So very quickly, before I turn it over to Kenneth, I would like to remind our participants that we do have two resources that might be useful for you. One was produced by the GBV AOR's help desk. And this is a 60-page learning brief that specifically looks at climate change and gender-based violence. So it looks at what are the links. We find this to be useful when you're looking for some language around the linkages, some of the studies that have been done. And so please do go on to our website. You can find this resource on our website. Let me go back. And then the other I wanted to introduce you to is a resource that was produced by the Irish Aid Consortium. And this one I liked as well because it gave a lot of case studies. And so it gave a lot of case studies that included really good best practice on how we can, programming practice on how you could mitigate risks, specific risks of GBV. And then lastly, I do want to reinforce that a big component of meeting the risks and responding is making sure that we have an emphasis on preparedness. And hopefully we'll have a little bit of an opportunity to talk about that as well. And I noticed our David from Accord did look at contingency planning a little bit. So I was happy to see that. Okay, without any further delays, I will turn it over to Kenneth. And I think my colleague Ruth, we are appreciative that Ruth will be sharing her screen. And then Kenneth can just prompt Ruth. And as mentioned, Kenneth, you have approximately 15 minutes for your presentation. Over to you, Kenneth.
Thank you, Jessica, and thank you for that introduction, and good afternoon, colleagues. So, Ruth, kindly. So thank you very much. Even as, doing a presentation in terms of the impact of the floods, it's paramount just to know that, yes, even as we are doing in terms of the response, we are actually also in the phase of doing a recovery in this phase. So as the rain subsidized, then as Kenya Red Cross, we are currently preparing that in terms of the contingency plans to ensure that we are able to support the community which were worst affected and within the different areas. So currently just doing both doubling up in terms of the response and also in terms of the recovery measures. So next slide. So basically this is just to showcase in terms of the situation currently. In terms of the flooding, we've been finding that some regions within Kenya, more so coastal, central, including Nairobi, Western Highlands and Rift Valley, and Lake Victoria Basin and Southern Lowlands have been receiving intense rainfall for this. And this has happened during the onset of the MAM rain. And out of this, we have been having multiple effects that has been documented in terms of the death, injury, displacement, and submerged arable lands impacting businesses and the livestock. So this has been exacerbated the humanitarian crisis during the onset of the rains. And currently looking at the map, the way it is, we expecting in terms of the rainfall to reduce, and there's more towards the dry weather conditions that are being predicted. And for this case now gives us an opportunity to support in terms of doing the recovery phase. Next slide. So this basically slides is in terms of the impact figures. In terms of Kenya, we have 47 counties, and more so in terms, we have 43 counties that have already reported on the issues of flooding. And out of that, we are finding that we have 99,454 houses that have been affected. Out of that, we have 53,440 and 30 persons displaced. And out of this, we are having 294 fatalities that have been reported. And out of this, we have 16 cases of GBV. And more so the impact that we're seeing, the roads have been cut off, around 68 roads. And this has shown in terms of a negative impact towards the issues when it comes to service delivery, because people are not able to access some of these services that we have within the different facilities. And more so, we are having 45 facilities that have been affected, and this has an impact in terms of delivery of the services within the community. So more so, we are finding in terms where we're having GBV services have been affected. The survivors are not able to access facilities as required. We're having schools around 151 schools that have been affected. Most of your schools have been used in terms of evacuation center, and this has had a ripple effect in terms of ensuring that school-going children are not able to go to schools, and this has an impact in terms of being exposed to some of the GBV incidents within the community. The businesses have been affected. Around 1,373 businesses have been affected. We're having 2,458 water sources being destroyed. Livelihoods in terms of the livestock, we have 11,539. And then in terms of the acreage of crops, as in terms of the 65,375. So looking at this, when you're compounding in terms of the effects that we are able to see, you're finding that in terms of the water sources being destroyed, then it means the community or the women and the girls within the community are able to move further in terms of search of water. And this exposes them when it comes to issues of GBV. And more so, we are having camps whereby camps have already been established and set up. And also this has in terms of ensuring that we are having these water sources in place, ensuring that in terms of the facilities, the sanitation facilities also as well have been affected on this case. So in terms of ensuring that we have that distinctions between the facilities where we're having in terms of male and female, also that has been a challenge in exposing the community itself when it comes to issues of GBV. Livelihoods also on that, and more so looking in terms of a negative coping mechanism, just to ensure that for this case, they are able to cope with the different mechanisms, because some of their livelihoods have been destroyed. I know we have been able to see through the press of the media, one of the counties in Nakuru County and Mai Mahiu, where one of the areas that was really, really affected in terms of the displacement, and some fatalities were reported, and more so importantly, in terms of their businesses. And just to ensure that they are able then to support in terms of building up their livelihoods, then there's aspect in terms of the negative coping mechanism on this. So looking at that is just in terms of infographics, just showing the different areas in terms of the numbers, those who have been affected, those who have been displaced, and for this case. So in terms of the GBV cases, we are seeing, yes, this is numbers. Looking in terms of the displaced, these are the numbers that have been able to be reported and been able to address. Even in as much as, yes, there are other cases which were being mentioned, but have not been in terms of the continuity, in terms of the completeness of it, then we were not able to record, just to ensure that they're able to get the services that they require. So on the next slide. So this
Kenneth,
is more or less.
There's a request if you could speak more closely into your microphone.
Okay.
Thank you.
So this is just basically in terms of expounding and giving just a context in terms of the impacts, in terms of the number. And more so we have mentioned in terms of the displaced and the loss of the livelihoods. And these are seen families in terms of the overcrowding, temporary shelters and camps with inadequate security, and this increases the issues of GBV. What we have mentioned in terms of the floods has been able to do this. This is the impact that we are foreseeing. We have the different camps across the country, currently around 179 camps, whereby we're able to see where different communities are housed or different households are being housed. And this exposes them in terms of the inadequate security, which predispose them in issues of risk in terms of the GBV. Most of we are finding women and girls, the particular in terms of being vulnerable, and when it comes to this, in terms of the sexual harassment and abuse, because there's lack of in terms of the different separate facilities. Because you see, for this case, when you're responding to emergency, definitely you cannot give them at the 100% in terms of the households, where they're living within their community. but just to ensure that some of the services are shared, but just to ensure that when it comes to a different aspect in terms of sanitation facilities, then you are able to ensure there's that separation, but also distance between them can be a hindering factor just to ensure that they exposes the women and girls, particularly to issues of sexual violence and harassment. With that, in terms of the loss of their livelihoods, this has in terms of the tension within the families leading to domestic violence, and this has been reported for the cases that the numbers we have foreseen in terms of the MHPSS services that we have been able to support the different areas and the different communities where been affected, the 43 across the 43 counties, and this has had a ripple effect. And more so, even as the community are picking up in terms of the recovery, there's a lot of stressors just to ensure that because some of them will not be able to recover what they had already put up in terms of their livelihood and in terms of ensuring that they're economically stable. So there's in terms of the displacement, and in terms of the displacement, yes, they are cut off in terms of the issues of food. Food is one of the issues that comes in as in terms of inadequacy. Is food, water, and sanitation challenges that have been recorded for this. And this has ensured that in terms of the health risk and the stressors that we have been able to see, not only just looking at exposing them to 2GBV, but other SRH and SRH and GBV services have also been having increased because now they are in terms of the access to some of these health facilities, then they are not able to access. In terms of looking in terms of the food, in terms of the water and the sanitation also predisposes them to this some of the health risk. In terms of the community social structures, there's that in terms of the displacements, brings in terms of the separation between the different communities, whereby it affects the protection issues. And we're finding that out of these protection issues, leaving women and girls more exposed as compared to the male counterparts, and now leading to issues of sexual exploitation and harassment, because that there is an aspect when it comes to them being in terms of their vulnerability for this case. So for the next slide, please. So in terms of the limited access, so we're seeing yes, infrastructures have been destroyed, and more so this leading to access in terms of the delay of the services. And this is more so looking in terms of the SRH services, but also in terms of the GBV services. And this one now discourages survivors from reporting incidents and seeking help, because we are finding now we don't have the structures that can be able to support this. And as much as yes, we are putting stopgap measures in terms of bringing in integrated outreaches, whereby they can be able to access some of these services, then it's not enough because you're finding this is only level 1 and level 2 services that we are able to administer. But in terms of the referrals, it becomes a bit of a challenges. And more so in terms of offering them the psychological support for this case and also the legal services. And this has, out of this, has also in terms of increasing the vulnerability of the special groups. And this one, we're looking at women and girls with disability, the elderly, the single mothers, particularly the vulnerable during the natural disasters. And this has been more because you're finding when it comes to even during this emergency, even in terms of the interventions, the way are designed, we tend to forget a person with disability and the elderly, because of that they might not be in a position to be able either to come either where we are doing a distribution of some of these items in terms of food, if it is in terms of the hygiene commodities or the humanitarian commodities, those are the dignity kits we have in the mama kits, or even for them to be able to access services in terms of the SRH services. If you find they tend to be overlooked when it comes to emergency. And more so in terms of the pregnant women, because of the due of the disruption of the access of services, despite yes, putting up stopgap measures in terms of the integrated outreaches whereby they can be able to seek some of these services, we are finding that it's still an issue for them in terms of the disrupted services, and then there's need for accessibility. There's no accessibility when it comes to healthcare. Next slide.
Kenneth,
So,
if you could again, Kenneth, sorry, if you can speak directly into your microphone and maybe a bit louder, that would be really helpful. Thank you.
I'm sorry, I think also my internet is fluctuating. That's why it's a bit Sorry for that. So in terms of the prevention and the response measures put in place is in terms of the strengthening of the protection mechanism. So during the onset, able to activate some of these in terms of the community watch groups and the community resource person in terms of supporting, either in terms of building, in terms of creating awareness, but more so even within the camps, we've been able to support put up safe spaces for women and girls in those temporary shelters, whereby we are coordinating also with other agencies, with other partners, and also with the county governments and the national government. But just to ensure that there's that continuity of care, then in terms of orienting and building a capacity of the different healthcare workers on some of the emerging topics that they're able to address, more so looking at the issues of clinical management of rape, then they're able to be supported on that. Awareness, just to ensure that they are able to raise in terms of the different risks when it comes to issues of the referral mechanism, then they're able to know during disasters when they can be able to come and seek some of these services. But most importantly, as we are continuing with that, in terms of collecting data using the different rapid assessment, which has been very beneficial in terms of addressing some of the gaps. And just to ensure that these are some of the gaps that we're experiencing, if it is shortage of drugs, if it's about the humanitarian and supplies, then we are using the real-time data to be able to support us doing that and to be able to respond. And most importantly, just the access to services using the issues of integrated outreaches and the provision of the humanitarian supplies. Those are the dignity kits and the mama kits. Dignity kits for both boys and girls, and the mama kits and the ARH kits in terms of the service delivery for sexual and reproductive health. So then the next slide, sorry. So this is just basically looking at in terms of the photos, just to show in terms of what has been happening. A lot has been happening. So the first photo on your left, you're seeing a situation whereby having Kenya Red Cross volunteers just trying to assess in terms of some of these are the farms that have been destroyed in terms of the water, just to assess in terms of getting in terms of the acreage. The second one that is following up, seeing in terms of the humanitarian commodities being dispatched to the field level, just to support in terms to ensure that access to services there's continuous access of services. And the far left we are seeing women, they're taking up some of the food items, just to ensure that there's that continuity when it comes to, even if their livelihoods have been destroyed, then they're able to get food for this case. And this last one, you're finding that this is more of a rescue mission. You can see closely, we are seeing that there are people on the other side in terms of the cutoff for this. The roads have been cut off. So this is some of the transport measures that have been used using different boats, just to be able to ensure that community are able to move from one point to the other. But most importantly, rescuing them and to be able to ensure that they are able to get the services that they require. So that's my end of my presentation. Thank you. Over to you, Jessica.
Thanks, Kenneth, so much. We have a few questions that I will pose to you during the Q&A. And I think we'll probably generate some more with David. I'm going to give David just a couple minutes here to upload his presentation. As I mentioned, we have David joining us from Uganda, specifically Accord Uganda, who is delivering services to flood-affected populations in Uganda. David, I'm going to turn it over to you. If, David, you could please speak loudly and into your microphone. We do have people with varying bandwidth, so that we would very much appreciate that. Thank you very much, David, and over to you.
Thank you very much, Jessica. So my presentation is going to be focusing on the impact of floods on women and girls, a case in point, the eastern part of Uganda. So looking at the hazards and floods in Uganda, At the moment, while Uganda natural climatic is moderate, it has experienced extreme weather events. The beauty with Uganda, it is increasingly experiencing more rainfalls, but as more and more rains keep on coming, it has led to the frequent bursting of rivers, mudslides, and landslides that has led to the loss of lives, property, and community, especially those living in mountainous areas. At the same time, those in lowlands experience floods. And if you're to look from 1900 to date, the country has encountered a total of 40 floods. The cumulative damage caused by those natural disasters amounts to over 200,000 deaths and at least 80 million USD economic loss. Now, the situation analysis for this current year from April and May 2024 marked the first mid of the first rainy season in Uganda, and this triggered natural hazards like landslides, mudslides in the Elgon and Rwenzori mountain ranges. Floods, heavy storms, and lightning were a characteristics of those specific happenings, and a total of 22 lives have been lost to date. The hazards affected a total of 37,866 individuals, affecting 11,015 households, with 12,731 people from 3,717 households internally displaced due to the adverse weather conditions. Now, the mostly affected age category has been the adults between 18 and 64, followed by children below the age of 18, and the elderly that took up 13% of that affected group. Notably and interestingly, more than half of the affected people were female. So, assessment, and with support from UNFPA, we conducted an assessment to assess the impact of mudslides and floods on access to SRH and GBV services in the Mount Elgon region, and the findings showed that 9 in 10 households that were interviewed were affected by floods and mudslides in the high-risk districts. And overall, women, children, people with disabilities, and adolescents were reported to be the most affected during the floods and mudslides. If we are to look at the region that I'm talking about, this is the Elgon region that is highlighted in the eastern part of Uganda, and communities could identify the hotspot areas that are mostly hit when these hazards come into play. Key issues were obstruction to access to nearby health facilities, because when these hazards happen, mostly the roads are damaged and the bridges, so it is quite difficult for the community to access nearby health facilities for services. Also notably, schools have a lot of challenges with their latrines being filled up due to flooding, and this has affected the well-being of the school continuation of the girl child. Majority, 90% of the participants in the assessment reported that women and girls face GBV during floods and mudslides. Displacements due to the flooding have their toll on women and girls, whereby temporary shelters and camps are set up. So you find like mostly these places are overcrowded, and there is lack of privacy, which heightens the risk of sexual violence and exploitation. Also, there is disruption in service and support systems, whereby flooding has also disrupted the access to essential services, including healthcare, legal aid, safe shelters, which are critical for the GBV survivors. Also, destruction of the infrastructure and homes has resulted into rendering families homeless, and damaging the roads and infrastructure, making transportation difficult. There's been a surge or an increase in domestic violence due to the economic strain. And for these people who are confined in these living conditions whereby they're living in temporary shelters, that has exacerbated domestic violence with tensions, often leading to more frequent and severe instances of intimate partner violence. And also the risky behaviors of transactional sex due to the desperate nature of these people in those temporary camps that are set up. The health issues have been also a major issue, whereby there's been an increase in the risk of communicable diseases, particularly women with children. Now we're having a crowd coming in one place. So you find like the sanitary living conditions in these temporary shelters further heighten the risk of sexually transmitted infections and other health issues, which these vulnerable populations face in the aftermath of the flooding. Also, this has a toll on their mental state, and looking at the trauma whereby these people who are the children and the girls who are experiencing and also witnessing violence happening, coupled with stress of the displacement, significantly affects the mental well-being of the women and girls in this region. This psychological impact can lead to long-term consequences, leading to anxiety, depression, and post-traumatic stress disorder. The economic and the dependence burden is also high. This is because the homes are destroyed, crops and livelihoods also are affected, leading to economic instability, whereby you find like the women in this region, they're mostly find they're the breadwinners of their homes. So you find that now they have a family to fend for. They end up doing transactional sex to secure resources for their families. So a snapshot of the different kinds of violence that was reported from the assessment. Physical violence was the highest with 80%. And the other kinds of forms of violence were spread averagely, whereby we had the emotional, psychological, and economic violence that was affecting the women and girls during the floods and the mudslides. Our response, or what have we done to combat this situation, Accord with support with UNFPA, embarked on a response plan whereby we ensured that there is available and access to life-saving SRH and GBV services for disaster-affected and displaced communities in the districts that were requiring emergency response due to the floods and landslides. What did we do? Basically, we set up safe spaces for women. There was distribution of MHM kits, and also trying to come into play to put in place a disaster recovery strategy, whereby we worked with the Ministry of Health and Office of the Prime Minister to ensure that the minimum initial service package is incorporated in the National Disaster Management Plan. Also, we've had a joint assessment on the impact of floods and of the mudslides on the access to SRH and GBV services in the Mount Elgon sub-region, which was carried out. And the next steps we're going to be supporting through humanitarian anticipatory action planning and contingency planning in the disaster-prone areas to develop contingency plans working with the community structures. This will help us to make these communities more resilient amidst these floods and mudslides that have affected them. Also, we've worked hand in hand with the districts to set up district disaster response teams and also with the communities themselves to set up the community disaster response systems and responses in the 20 sub-counties in the 7 affected priority districts that are affected by these disasters, specifically floods and mudslides, which stood out the most. Also, we've built the capacity of the healthcare workers or the healthcare service providers, specifically the hospitals, through building their capacities in MIS, CMR to ensure delivery of skilled services. Not forgetting mainstreaming GBV and SRH in disaster contingency plans, whereby we've supported 7 districts in the region to come up with their disaster contingency plans. We've also provided safe spaces, women's spaces, to provide psychosocial support for the survivors of the floods, and also provided SRH and GBV commodities in the healthcare facilities. And lastly, socioeconomic empowerment of GBV survivors through livelihood projects like tailoring, bakery, whereby they've been given the skills to fish, having lost most of their plantations, whereby they earn a living. So now they've been equipped with socioeconomic empowerment skills, whereby they can be more resilient amidst these challenges that they face. I thank you. Over to you, Jessica.
Thank you. Thank you very much, David. Both you and Kenneth, we've had a very vibrant chat over here. So we have lots of questions. And I really appreciate that both of you kept to exactly the time, which is means that we have about 20 minutes for the question and answer period. And we have a lot of them. So I see people still writing in the chat. I'm not sure we're going to get to any new questions. So please note, if you're just now writing questions, I might not get to yours because we have so many other really thoughtful ones that were asked. So I'm going to start maybe with Kenneth. We had quite a few questions that were grouped around school-age children. In your presentation, it mentioned that 21 schools were affected. And so many people, again, I'm grouping questions here. Many people are wondering what was the impact on adolescent girls, because we no longer had that protective school structure available. And then also, I think just in general, what was the impact really of, yeah, I'm going to stop there. How about I just start? What was the impact of those 21 schools impacted or affected, and specifically on adolescent girls? Over to you, Kenneth.
So thank you, Jessica. And actually, it was 151 schools, and these 151 schools cut across.
Sorry, 151. Sorry, that's much bigger. So even better. Yeah, not better, but even
so
more relevant.
So it cut across, yes, in terms of the lower level, the upper level, in terms of differences. So
Kenneth, we're losing you a little bit. If you could really speak into your microphone very loudly, please. Thanks.
Am I audible?
Better, but I think you have to stick right into your microphone. Thank you.
So as I mentioned during the presentation, yes, in terms of the schools being affected, one of the things that we came to understand was in terms of the exposures, the adolescent girls and boys were being exposed to, because school act as a barrier, maybe a protection mechanism within the different communities where they are going to school. So one of the things, yes, it's in terms of the numbers, I may not have the actual numbers just to document that, but the cases that were being reported in terms of the SGBV, we were finding, yes, it was ranging from the adolescent to the adult and also to the older population for this case. So yes, there was a bit of issues regarding that, but most importantly, had a very coordinated in terms of multi-sectoral approach, just to ensure that even as they are not going to school, then we are having in terms of the protection mechanism in place, just to ensure within the camps, and then working very closely with the community watch groups, the community established a response team, just to ensure that they are able to engage them, either during, because some of the areas they were having spaces whereby they can be able to converge, where they can be able to play, and some of the areas that they had. And then most importantly, we had the sessions, MHPSS sessions that they were being provided. So there was an aspect in terms of the engagement, in terms of the areas whereby it was maybe so for Nairobi areas, in terms of areas, especially Nairobi, where they were having a space. Then we could find a session whereby they can be able to engage on the different mechanisms. And most so the issues of MHPSS was brought on board, and then working with other stakeholders just to ensure there's that issues in terms of the protection mechanism in place. Yeah, thank you.
Great, thank you, Kenneth. I'm gonna ask David, we had quite a few questions that were centered around data collection and specifically how you were able to collect data and who was involved in your data collection process, and do you think it was representative of the issue overall? Over to you, David.
Thank you very much. To speak maybe into the methodology for the assessment that was done, it was a participatory process utilizing both qualitative and quantitative methods of data collection, conducted by an independent consultant in collaboration with ACORD. The study design was a cross-sectional design, and the sampling procedure, both the probability and non-probability sampling methods were adopted. Going through the assessment findings and maybe the methodology to speak into the data that we collected. So we conducted key informant interviews, and the sample size was 384. The survey attained 100% response rate for those who consented and participated in the assessment. And the districts that were covered, we covered 6 districts of Manafwa, Bududa, Kapchorwa, Namisindwa, Bulambuli, and Mbale. And there was also a little bit of desk review that was done from the different research findings that we had, because there was a needs assessment report that was done by the Office of the Prime Minister. So part of the findings into the assessment that was done, the assessment review helped us to also explain on those high level kind of issues. So in a snapshot, that was it. We conducted focus group discussions and key informant interviews that helped us to speak into the findings from these different districts. A total of 8 focus group discussions were conducted. Amongst 78 were male and female participants, including youth and adults. So that speaks into the data and how we obtained the findings that speak into the assessment results. And it was true of, because it was speaking into also the subsequent assessments that were done in that specific region.
Great. Thank you, David. That's super helpful and clarifying. And now, Kenneth, we noted in your presentation that you identified 16 cases of SGBV, and a few of our participants had noted was how did you collect that data? And also, can you put that into context? because we often know that those who seek services are really just the tip of the iceberg in terms of the true numbers of survivors. And I think they were wanting you to put that into context versus all of the infrastructure or services that you said were either destroyed or disrupted due to the flooding. Over to you, Kenneth.
So thank you, Jessica, for that. And even in as much as, yes, we were responding, we were not only just responding as Kenya Red Cross alone. This was a multi-sectoral in terms of the approach, in terms of the response. So having different players in this place, being able to participate and to be able to support in terms of responding to the different issues. So particularly for GBV, even in as much as in terms of the health facilities were being, in terms of the access was not being available, we had temporarily in terms of posts, whereby they were put either within the camps or around the camps. In areas where we didn't have camps, then we have temporary posts. And this is where the community were able to come and present their case and then be able to report. So the 16 case, it is basically what underwent in terms of the case has been reported, and the survivor has been seen and be able to receive the first line care. So that is how, in terms of the numbers that are reporting. So, and for this, in terms of the 16, these were more cases that came from our camps within Nairobi County. So that's how we ended up. And in terms, these were numbers that were recorded. They can also be verified. And also in terms of ensuring that those survivors have been able to get the services, and there's that continuity and there's that follow-up process that is still ongoing, just to ensure that they are able to get the services that they require. Yeah, thank you, and over back to you.
Great, thanks, Kenneth. But I do want to reinforce that notion that, again, that maybe Red Cross had identified 16, but there could be a whole host of survivors that are unable to access the service due to various reasons, even stigma and fear of retaliation, as Kenneth mentioned, because of a lack of service availability. And the reality is that we collect a lot of our incident data at service points. So if survivors don't feel safe accessing a service, then we're unable to collect data around that individual. And if the service doesn't exist, obviously, then that's also a huge challenge for us in terms of data collection. And again, the biggest message here is we know universally that GBV exists. So we don't even need the data at the onset of this emergency to understand that dynamic, because we have even household level survey data from the DHS surveys, which are done more in development contexts. So imagine if we know the prevalence of violence in a development context, and we know that it's exacerbated during emergencies, so we can kind of extrapolate what some of those needs are. Yep, and Mohammed is saying also lack of confidence in service providers, lack of trained staff, and then again, also very much so just a lack of confidentiality as well. So good. Thank you very much, Kenneth. We had a couple of questions centered around persons with disabilities. And so maybe each of you could speak to this. I'll go to David and then Kenneth. Can you tell us a little bit about what you did in order to take special considerations for persons with disabilities? And if you didn't, you can be transparent about that as well, because I think it's an area that we all need to do better in, frankly. And so it's also understanding what some of the gaps are as well. Over to David first, and then this one I will also ask Kenneth as well. David?
Thank you very much. So we also had stories from the people who are affected, people with disabilities, and specifically 12% of the sample size 47 of them, there were people with disabilities, specifically physical impairment, followed by hearing problems and visual impairment based on the ranking. And I'm going to go to the maybe specific challenges that were affecting them. Okay, mostly these people with disabilities, they just like now, once you're having the general population as they are moving to these camps, the people with disabilities were having issues with access as well, which stood out the most. And the highest district that had that was mostly affected based on the ranking was Bududa, followed by Manafwa, and maybe if I can also invite some of our colleagues, the program staff that are on ground, to speak on some of maybe the intended interventions that are being done. I'm going to invite Anthony to help speak into the program-related activities that are disability focused. Anthony. Anthony or Joanne, if you can speak into that.
Yes, hello, thank you for, David, thank you for the presentation. It was really a great one. Among the interventions, and yeah, it's true that we consider disability in doing the assessment. As in addition to what David has said, we're able to interact with over 12% of the disabled people, and most of them were really positive and like the idea of interacting with them about GBV within the district. In addition to what David had said earlier, some of the interventions around GBV concerning the PWUs is involvement in all activities that we are doing. We have continuously involved people with disabilities in every activity to motivate them and encourage them in case of anything that can happen. Thank you. Back
Great.
to you.
So
Thanks, Anthony.
Jessica, maybe to finalize on the stories that we had, these are some of the responses. They are handled like any other person. In most cases, they come to you at a facility and you offer a special service according to the condition they have. That was from a KI, from Bududa. Then other stories, VHTs attend to them house to house through outreaches and looking at maybe special needs. There are no ramps at public facilities, but the district is trying to adapt in the new construction. When it comes to disaster, it is worse because there is no help. The DMC rarely sits and has no budget. Therefore, there is need for the district budget to include the DDMC activities as per policy. And lastly, access to sanitation services, better sexual reproductive health services are what the people with disabilities were hoping to get.
Thank you, David. So David is presenting us with some of the gaps and challenges, which is really important for us to understand. Kenneth, we have one more minute. Did you want to add anything to the inclusion? How in the response in Kenya, you have considered inclusion of persons with disabilities?
Yes, Jessica, in terms of Kenya Red Cross, yes, when it comes to the interventions, response intervention, then we have it has inclusivity aspect to it. And most of this is guided in case of any onset of maybe disaster, and for this case, floods. Then we are able to carry out assessments And this assessment has a section in terms of the issues of protection, whereby we are able now to pick out issues around the person with disability. So even as we are gearing towards the response intervention, then we ensure it's very inclusive, just to ensure that everyone is able to enjoy the same services as them. So yes, we have the internal issues in terms of the internal tools that we use, and also the external, where we are having the multi-sectoral external tools like KIRA, whereby issues of protection. So it is out of that, then it will be able to guide us in terms of how to design and just to ensure that we are leaving no one behind when it comes to our response and also as we are getting towards a recovery. So thank you, and over back to you.
Thanks, Kenneth. I think that we could delve a lot deeper into the issue of making sure that we're meeting the needs of persons with disabilities. As we know, studies have shown us that approximately 25% of survivors who have a diagnosed disability, or it's perceived. And therefore, can you imagine 25%? And then imagine those that are undiagnosed, right? That don't have this breadth of services to be able to do a diagnosis. And so this is why this is such an important issue. So I appreciate all of those in the chat who asked about persons with disabilities, because a very important population, but also one that is really representative in terms of our survivors. I just wanted to close with, we had some questions around dignity kits. What is the contents in a dignity kit? We also had questions around assessment tools. We had questions around mama kits, and then also shelters. How would you set up a shelter that is for those with disabilities, but then also protective of women and adolescents? You can find resources on all of these specific topics on our website, which is gbvaor.net. I put a link in the chat, but you can simply do a search. Please do go on our website. We collect all of these resources from all of our partner organizations and then upload them. We also have a lot of webinars on some of these different topics. So please do go over to our YouTube channel. If you go on to YouTube and then just search for GBV-AOR, you will see that we have lots of different webinars, learning events on many of the topics that you're also looking for. Closing, if you would like to have more information on any specific topic, or you have an idea for a future emerging practice webinar, please do reach out to our admin, who is Christine Cabelle, and she can see if we can make your request a future emerging practice. So please do reach out to Cabelle. Cabelle, if you could put your email into the chat. As I mentioned, this recording will be uploaded to our YouTube channel either later on today or tomorrow. So please do look out for that. And we look forward to seeing you all at some of our future learning or advocacy events. On behalf of the regional GBV-AOR for East and Southern Africa, I'd like to thank the Kenyan Red Cross, specifically Kenneth, and Accord Uganda, our colleague David, for joining us today. And I know that you're both very busy, and we really appreciate everything that you do, and your teams and all of the other partners who are working tirelessly on the ground to make sure that women and girls are safe. So thank you all, and I hope you have a good afternoon.